Guys, okay, today I'm going about nursing process. So nursing process means mainly the planning is deliberative and systemic phase of the nursing process. So here decision making and problem solving. Decision making means already patient have some symptoms, you should solve the problem. Okay, take proper making and to take proper decision and to find, then you solve the problem. Okay, so refer the clinical assessment and date of diagnosed statements for direction and formulating line goals and designing to the nursing intervention. It's required to prevent, reduce, the eliminate of the health problem. So types of planning means initial, when patient come, that time initial planning. So patient already 12 o'clock they're admitted, in 5 o'clock that is ongoing. So next 10 o'clock discharge means that is discharge planning. Okay, so initial patient admission assessment, so that admissions procedure we can do it. So what are the information we can give for nurse and evaluate the patient response. If you are giving, I'm going to put IV line means that you can explain. Okay, explain, then you can evaluate the your patient accepting means that is response to care. So that is the initial. Okay, so ongoing process means if you are putting any injection or anything is, then if your afternoon dose given, night dose any changes is that you can explain, that is otherwise after 6 hours any post operative surgery is there like this means that is another informing, and that is for ongoing process. So who work with the client, okay, all the nurse. Okay, so ongoing planning to occur behind the shift nurse plans of the care. So discharge means after everything patient is comfort, then patient resolve all the health problem, that is the discharge planning. That process is anticipating and planning for the needs and after discharge. It is the comprehensive health care and should be addressed, and each client care plan to be given that day. Okay, so purpose of ongoing plan. So this is what means, what purpose will be the determine the any changes of health status. So sometimes PP will be high, PP less, glucose like this and all. Okay, so set priority of the client care and decide which is the problem to focus during the shift. So each shift plan what which care want to go like this and all we can plan. Okay, so coordinate of the nurses activities. Mainly we know all the shift changes. We all shift three shift staffs coordinate. It's important. Okay, so developing of the nursing plan. So it's a informal nursing care plan, then formal nursing care plan, then standardized care plan, then individualized care plan. On informal nursing care plan means it's a strategies of action that exist in the nurse's mind. So formally once. So what are the standardized care plan means? It's a formal plan. So nursing care groups of client and common needs of the patients. Okay. Then individual care plan means so meet the needs and do the needful. That is the individualized. Then guidelines for writing nurse plan means data and sign the plan. So what are the data? Patient complaints. Okay, so use the category heading assessment and nursing diagnosis and planning implementation evaluation. So assessment, what are the physical examination? Either have patient linked to breathing difficulty. Nursing diagnosis, what we'll do? We can relieve the airway. Then planning, for what are the planning? We can give comfort positions, that is under planning. Implemented, patient come out. Then evaluation, patient discharge, it's normal. Okay. So standardized medical or English simpleness is keywords rather than complete sentence communicate. There is an no need. Then guidelines of writing nursing care plan means because now working shift for different lenses. Somebody is working to 12 hours, 8 hours, and 6 hours. So specific intervention here there we want. So change initial nursing dressing Q shift. Okay, refer the procedure and books, sources of information to steps on the right plan. So guidelines. So I can tell you because here mainly assessment, planning, implementation, evaluation is important. I will next column I can teach you. Then ensure the plan and contents intervention for ongoing assessment of the client. So include the collaborative or coordination activities in a plan. Include plans for the client discharge to home care needs. So the planning process is setting the priorities and establishing So what are the planning process means setting priorities and establishing the client goals and selecting the nursing intervention and writing the nursing orders. Okay. So here assessing means what collect the data, organize data, validate data and document the data. So diagnose means analyze the data, identify the health problems, risk, strength and formatting the nursing diagnosis. Planning means setting the priority, establishing the client goals and decide the outcomes, and selecting the nursing intervention, writing the nursing form. So setting priorities means what is setting priorities, addressing the nursing diagnosis interventions. So primarily we can give the attention to the patient and secondary also on ongoing process. So rank ordering diagnosis means nurses can group of having high or medium low priority. It require minimal nursing support. So high means life threatening problems such as a loss of respiratory and cardiac function. Medium means high normal acute illness and decreased coping. So here we can Maslow hierarchy that theory we can use. So here client health values and beliefs and client priorities, resources available to the nurse and client, urgency of the health problem and medical treatment. So here establishing the client goal and desire. So after establishing priority, the nurse client set goal of each nursing diagnosis. So goal means broad. So nutritional status. Specific means gain or loss of gain. So short term goals means 6 weeks period. Long term goals means more than 6 weeks. So selecting nursing intervention activities means it's independent, depend, collaborative. So independent means activities that nurses license the initiative. So physical, ongoing assessment, counseling, emotional support, environmental management. Dependent activities carried out under physicians. So medications, diagnosis test and diet activities. Collaborative means nurses to carry the health team members. So physiotherapist, social worker, dietitian, physician, it will be there. So this is the nursing care plan. Nursing care plan I can show next class. Okay. Bye guys.